Welcome to our webinar today on running a non-invasive ventilation scenario with the RespiSim system. My name is Liz Bolin, and I am the account executive here at Ingmar Medical, and I'll be your host today. To tell you a bit about myself, I have a pretty checkered sales background in the healthcare industry. I've sold medical supplies such as catheters and ostomy bags, and I've sold exam preparation software for medical students and residents. I've been with Ingmar Medical for just about a year and a half now, and I know so much more than I ever thought I would about the lungs. And being someone who struggles with asthma, I have a whole new appreciation for our lungs and especially the people who care for them. I also have Jessica Dietz here with me today, and I'll let her introduce herself.
Hi everyone, I'm Jessica Dietz. I'm one of the clinical educators here at Ingmar Medical, as well as a respiratory therapist, and I will be able to answer any of your clinical questions after the webinar is concluded.
Let's review the agenda for today's webinar quickly. We'll start out with a review of the ASL 5000 breathing simulator and the components that make up our RespiSim system. Then we will learn our approach to running a successful multi-stage simulation with the RespiSim system. Next, we'll apply those concepts to our understanding of RespiSim curriculum modules. And lastly, we will watch a pre-recorded scenario that demonstrates the use of our approach to a multi-stage simulation. After the video, we'll do a short overview and end with time for questions. Let's get started. For those of you who are not familiar with Ingmar Medical, I'm going to do a quick overview of the approach we take to creating simulations with the RespiSim system. At the heart of the RespiSim system is the ASL 5000 breathing simulator. Within the ASL 5000, there is a piston moving inside of a cylinder. Through our RespiSim software, we control the movement of the piston to create breathing patterns based on the equation of motion. You can either connect any real ventilator directly to the 22mm port on the front, or we do have multiple options for integrating a mannequin into your simulations. We use the technology of the ASL 5000 to simulate lung models that are consistent with a nearly unlimited range of respiratory conditions, including some of the most common conditions that you see listed here. For today's simulation, we will be using our RespiSim System Pro package shown here. As I mentioned before, you can simply connect a patient circuit directly to the front of the ASL 5000. However, I do want to review this more comprehensive teaching environment that you will see in the video today. As the foundation of the system, we will be using the ASL 5000 to produce our patient's lung mechanics and breaths. We are controlling the RespiSim software from what we call the instructor view that the learner cannot see. And the learner is on the other side assessing the patient's chest rise and lung sounds, viewing the realistic patient-ventilator interaction on a real ventilator, and referring to the virtual patient chart monitor for assessments such as X-rays, vital signs, and blood gas values. Now that we reviewed the ASL 5000 and the RespiSim Pro package that we will be using in today's scenario, let's review our approach to running successful multi-stage simulations within our RespiSim software. As we all know, there are no standards for mechanical ventilation training. However, we do have the opportunity to take advantage of the promise of medical simulation for ventilation training. Simulation allows us to gain experience treating virtually any patient with no risk to actual patients. And it can take our training from being just adequate to truly effective. Today's simulation is what we call a multi-stage scenario in which the learner experiences multiple challenges during the course of treating one patient over a period of time. And the RespiSim system employs a specific approach to this kind of simulation that we will review next. For this type of multi-stage simulation, we generally have to accomplish two things simultaneously. While simulations are meant to be highly realistic, The flexibility that the learner has with their decision making needs to be reined in to a degree in order to stay on track with the main objectives. The RespiSim approach for this need is to keep the instructor in control of the patient condition throughout the simulation. For example, if the learner notices their patient is not ventilated correctly and makes the proper changes to the ventilator that would improve the patient's ventilation, we as the instructor need to reflect that through the RespiSim software by slowing down the patient's breathing rate and improving their vital signs and blood gas values. However, if the learner makes a treatment decision that is incorrect and would take the simulation way off course, we as the instructor need to rein in the learner by explaining why that is not the correct avenue and to try again. This instructor-driven approach allows us as the instructor to keep the simulation on track to meet our objectives and guide the learner through each challenge. Another aspect of our approach to multi-stage simulations is the need for the learner to successfully complete each individual challenge before moving on to a new challenge in the next stage of the simulation. The RespiSim approach for this need is to provide limited, controlled outcomes at each stage that include only one optimal correct answer and a few common incorrect answers. For example, when a learner is faced with a problem, we will have a few controlled outcomes, including some incorrect answers with the appropriate negative changes to the patient condition, and one optimal correct answer with the appropriate positive changes to the patient condition. The completion of that optimal outcome will then allow us to move on to the next stage in the simulation where we present the learner with another problem. These controlled outcomes, once again, keep our learner reined in and focused on the main objectives of the simulation. More importantly, these controlled outcomes incorporate some common mistakes and their negative outcomes that will result in valuable teaching moments. The last aspect of our approach to successful multi-stage simulations is the need for the learner to use assessments to make their treatment decisions. The learner will, of course, rely on the realistic patient-ventilator interaction between the ASL 5000 and the ventilator. However, we also need to paint a bigger picture for the learner to make more informed decisions, just as they would while practicing with real patients. The RespiSim approach for this need is to include appropriate assessments for each possible patient condition and controlled outcome. These assessments include vital signs, blood gas values, x-rays, as well as heart and lung sounds. This way, during their initial assessment, the learner can use these assessments to inform their treatment decisions. And after the learner makes the decision, they can see the outcome of how their decision has affected the patient. Now that we have reviewed the approach we take to multi-stage simulations, let's learn about the vehicles we use that put our approach into action. A lung model in the context of the RespiSim software is a combination of resistance, compliance, and spontaneous effort parameters. A curriculum module consists of multiple lung models connected to the appropriate assessments to create the multi-stage scenario. So, curriculum modules are the vehicle we use to build and run multi-stage simulations. They include all of the components necessary to run the simulation, and they follow the RespiSim approach we just discussed. They are instructor-driven, they have controlled outcomes, and each lung model is tied to supplemental assessments. Let's now take a look at a curriculum module before jumping into the simulation. Here you see our instructor dashboard, the environment we use as the instructor to control our curriculum modules. Within a curriculum module, we have multiple columns which represent the patient's condition at a given point in the scenario. Each of these columns consists of a file containing the breath parameters, the vital signs, and blood gases for our patient, and the settings that should be applied to the ventilator at that time. By activating a column, the ASL's piston movements adjust according to the new breath parameters, and the patient's vital signs and blood gases are updated for the learner. Please note that the ventilator reference settings are simply just reference settings. So changes to the real ventilator are not controlled by our software and are done manually, just as they would be in real life. For each of our curriculum modules, we have built a number of columns which are our best predictions for the decisions our learner will make, both incorrect and correct. These are the limited outcomes that I mentioned before when talking about the RespiSim approach. When the learner makes a decision to treat the patient, the instructor adjusts the condition of the patient by enabling the appropriate column. Generally, we build scenarios which are designed to address one specific learning objective at a time, so our columns are typically structured to provide you with a range of decisions from least optimal on the far left to optimal on the far right. In addition to viewing the real ventilator screen, the learner can also be provided with various assessments during the scenario, such as vital signs, blood gases, lab results, X-rays, as well as heart and lung sounds. These assessments can be set to appear on a separate screen that is displayed specifically for the learner during the scenario. Today, we will be demonstrating our non-invasive ventilation curriculum module. This module moves through 2 stages and has 4 main objectives. First, the learner must perform the appropriate assessment of ventilation in the non-intubated spontaneously breathing patient. Then, the learner must recommend and initiate non-invasive ventilation. Next, the learner must adequately manage the ventilation while utilizing non-invasive ventilation. And lastly, the simulation advances to stage 2, and the learner must reassess the patient and manage oxygenation while using non-invasive ventilation. Here are your objectives to focus on while watching the simulation. The foundation of this simulation is provided by the realistic lung mechanics and breaths produced by the ASL 5000 breathing simulator. While watching the simulation, please bring your attention to the realistic patient-ventilator interaction between the ASL 5000 and the BiPAP machine. To run the simulation, we use one of our own curriculum modules in the instructor dashboard environment of our RespiSim software. While this webinar is not intended to be a step-by-step instructional video, you will see our approach to multi-stage simulation in action through the use of a curriculum module within the RespiSim software. Lastly, pay attention to how we use supplemental information such as vital signs and ABGs to inform the learner's treatment decisions throughout the simulation. Let's start the simulation. Today, I'll be demonstrating a live scenario using the RespiSim system. To run this scenario, we will be using our non-invasive ventilation curriculum module in our instructor dashboard environment within the RespiSim software. According to our initial settings column, the patient starts out on a 4-liter nasal cannula. Our vital signs indicate the patient is tachycardic, hypertensive, and hypoxic. And our blood gas values indicate the patient is acidotic. At this time, we will introduce the learner to the simulation, and we will present our patient information on their monitor. Our patient is a 67-year-old male who was admitted through the ER for a COPD exacerbation and is stating he has a breathing problem. He has thick yellow sputum and also has an 80-pack per year history of smoking. The learner begins to further assess the patient and at any time can ask for supplemental information such as lung sounds, X-rays, ABGs, and lab results. The learner requests a chest X-ray. As the instructor, we will then make the X-ray appear on their monitor. Upon seeing the X-ray, the learner observes some consolidation in the bases. Next, the learner then requests the vital signs and ABGs. As the instructor, we will make this information appear on their screen. The learner notices the acidosis and hypoxemia. The learner states they will listen to the patient's lung sounds. As the instructor, we will activate this information. The learner listens to the lung sounds and hears wheezing. Now, the learner is expected to make a treatment decision based off of their initial assessment of the patient. As the instructor, we will observe and listen to the learner as they make their treatment decision and, if necessary, change the patient condition as a result of their decision, either for the better or for the worse. The learner decides to put the patient on BiPAP 12/5 at 60% O2. As the instructor, this action prompts us to enable column 5. Our instructor actions explain that with a change in pressure of 7 centimeters of water, the patient is still not ventilating correctly. The ventilator indicates the respiratory rate is still high, the patient is still short of breath, and he is using accessory muscles. In addition, the learner notices that the vital signs and ABGs indicate that the patient is still hypoxic and still slightly acidotic. As the instructor, we will encourage the learner to reassess their decision and try again. The learner decides to increase the IPAP to 15. As the instructor, this action prompts us to enable the optimum setting column. Our instructor actions show that this was the correct decision. The ventilator shows the rate has slightly decreased, therefore his work of breathing has decreased and he is now more comfortable. According to his ABGs, the pH and PaCO2 have normalized with his ventilation, but PaO2 remains low. Our instructor actions show us that the simulation has progressed to 4 hours later. The learner is expected to reassess the patient. The learner sees that according to the vital signs, the SpO2 has slightly decreased. The learner requests new blood gas values and sees that the PaO2 has decreased as well. This information indicates that there is an oxygenation issue with the patient. After this new assessment, the learner decides to increase the PEEP while maintaining ventilation at the same time. This results in an IPAP of 20 and a PEEP of 10. As the instructor, this action prompts us to enable the optimum setting column. Our instructor actions show that this was the correct decision. The ventilator shows the work of breathing has decreased even more, making the patient less tachypnic. Our vital signs monitor now shows the SpO2 increased and the learner sees the PaO2 increased as well. The simulation is now complete and the instructor and the learner can debrief. That concludes our scenario for today. I hope you enjoyed what we put together. As a quick overview, our approach to the multi-stage simulation is to provide the most realistic experience with the ASL 5000, but also to rein in the flexibility of the decision-making to stay on track towards our objectives. The tactics to achieve this approach are to keep the instructor in control of the simulation, limit the possible decisions and outcomes the learner can make, and supplement their decisions with assessments. Our library of curriculum modules are the vehicles we use to put this approach in action. And lastly, the ASL 5000 is an excellent tool for teaching mechanical ventilation, but as we just saw, it is also an outstanding tool for teaching non-invasive ventilation as well. The brief scenario we just viewed was one of our curriculum modules, and we do have over 40 total modules available for our users, covering a range of topics common to mechanical ventilation training. These modules are built by our clinical educators who are respiratory therapists themselves, and we also work with leading educators in the field of respiratory care to develop scenarios that are aligned with our customers' needs. Though we do use a number of research studies to inform the parameters that are pre-programmed for our scenarios, we do ensure that all aspects of the scenarios, from the breath parameters to the vital signs and x-rays, are fully customizable by our users. So this way, you can tailor the scenarios we've created to meet the needs of your curriculum. Now we're going to address any questions you may have. Please use the Zoom chat function to type in your questions and we will address them live. To help with your questions, I have clinical educator Jessica Dietz with me. The first question is actually, what kind of mask was used in our simulation on the mannequin? The answer is the mask is from Philips Respironics. It's called AmaraView. It's a minimal contact full face mask, and we used the size large for our Respi patient mannequin. Okay, next question is, what mannequins can be used with the ASL 5000? Great question. In the scenario you saw today, we were using our own Respi patient mannequin, or we are actually newly compatible with the Laerdal SimMan 3G, the SimMan Essential, the 3G Trauma, and the Essential Bleeding. Okay, another question here about, is the ASL 5000 compatible with other ventilators aside from BiPAP? The answer is an absolute yes. It is actually compatible with any ventilator and any ventilator mode. I am getting some questions about the cost of certain items. We can absolutely address that offline. I do have a survey being sent out after the webinar is complete, and if you do mark that you are interested in learning more about our respiratory equipment, we will be able to get in contact with you and provide you any kind of information or pricing that you may need. Next question, is this simulation program available in any way for online students?
As far as being online, we usually teach either through a live distance training or on site. We don't have any kind of learning management system currently where students can access at their own time of how they would learn. We don't have that currently.
Another question, do I have to use a mannequin with the ASL 5000 or to run a scenario like this one? The answer is no. You can actually plug the patient circuit of your ventilator directly into the front of the ASL 5000. There's a 22 millimeter port there. So no mannequin integration is required to generate that realistic patient-ventilator interaction because the breaths are produced by the ASL 5000. But the mannequin will add haptics, obviously including the realistic chest rise and practicing procedures such as auscultation and intubation.
We have another question about modes of ventilation here, and the answer to your question is the ASL can work on any mode of ventilation, whether it's an advanced mode like APRV or something very simple like volume control.
And yes, someone specifically asked about whether the ASL 5000 can support any kind of mechanical ventilation, including CPAP to complex pressure volume ventilators. The answer is yes.
Yep. Any type of vent, any type of mode. People have used it with an oscillator as well.
We'll leave a couple more minutes here in case a few more questions pop in. I am going to switch the slides, so if anyone wants to reach out to us post-webinar, I will have our email address here and our phone number. Please reach out to us. Any questions, any comments, any feedback, you want pricing, whatever it may be, we're here to help you. So please reach out to us. As I said, there will be a recording of the webinar sent to your email, and you will also receive a survey so you can leave feedback. And if you do want something like the pricing and have any product questions, we're more than happy to help you. Either reach out to us directly, or you can mark in the survey that you are interested in learning more about this respiratory equipment.
So I have a question here about the respiratory rate. Yes, the respiratory rate is controlled by the ASL, and yes, the student would see those changes on their screen, as well as your own screen you would see them on as the instructor.
We also have a question on whether we have a pediatric mannequin. Currently, we do not have a pediatric mannequin. However, the ASL 5000 is able to produce breaths neonatal all the way to adult just in that one device. So while we don't currently have a pediatric mannequin, your best bet would be plugging the ventilator circuit directly into the front of the ASL and setting those pediatric parameters just to show that realistic interaction on the vent.
We have a question from Angelica here. I think I know how to answer your question, if I'm not confusing myself with the question here. But the whole system is a closed loop system. So there's pressure sensors inside of the ASL that feed back the data into the software, and that is how we create the waveforms and loops inside of our own software. And it works at about 2,000 hertz, so it samples it at about 2,000 times a second, so it's extremely accurate data.
But what you're seeing on the live ventilator screen is just, the ventilator doesn't know any different, it's just responding to the breaths that the ASL are producing, so our software does not affect the waveforms that appear on the ventilator. It's just really reacting to the breaths, just as it would a real patient. Great questions so far, guys. We will leave a couple more minutes on here for any that pop up. Again, thank you so much for attending the webinar today. We love your feedback, so please answer the survey that we send out, enjoy the recording, and share it with any other colleagues, as we will be providing a recording via email. Please reach out to sales@ingmarmed.com. Pete and I are more than happy to answer your questions, provide you pricing information, any kind of customized support you may need. And I hope you all have a wonderful day. Thanks again so much.